Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I've been a cardiologist for 40 years. We have a number of presentations on heart healthy lifestyle, including diet and cholesterol reduction and all other aspects related to the heart disease. The focus of this presentation is low carb, high protein snacks. Patients with history of heart disease, with history of diabetes, with history of hypertension or renal problems do have limitations as far as calories, salt intake, cholesterol intake, and fat intake. So from a cardiology perspective, I'm going to look at all the different snacks that are available in the market and come up with the winners that will help you to get low carbohydrates, low fat, high content of protein, low calories, and reasonable price. So, whenever you're looking for a snack, especially with the history of diabetes, high blood pressure, or heart disease, you have to make a whole number of choices. You have to become like a nutritionist in order to decide what is good for your heart, what is good for your diabetes, what is good for your high blood pressure, and what's good for your kidneys. So let me help you navigate through these things so that you become an educated, informed consumer. So whenever you are looking at snacks, obviously we think about chips, nachos, all these things which are just time bombs to speak of. And there are also the so-called special snacks, which I'm going to talk about in a minute. But let's begin with the basic foundation of how we evaluate the nutritional aspects of a given snack with reference to an existing medical condition like heart disease, diabetes, high blood pressure, or kidney problem. Okay, first of all, when you look at, please follow me with this green arrow, it has to be low in carbs. No matter what condition you have, or even if you don't have any condition, if you're obese, then you should be thinking about low carbohydrates, because any excess of carbohydrate, gram per gram, is going to be converted into fat, and that's going to be deposited in our bellies and butts for the rest of our lives, and we don't need that. We don't need that extra carbohydrate. If we don't need it, we shouldn't take it. Next thing is, the snacks should be low in fat, and it may be a myth when you look at some of the packages that have so big nutritional labels stamped all over the package, but when you look at the fat content, that may surprise you. They should be low in calories. Not everybody is concerned about calories. If you look at certain brands like keto-friendly, the calories may be more than what you get in an ounce of potato chips. And high in protein. Of course, there are snacks which are high in protein, and we're going to also explore some of the things that you can prepare at your home within 5 to 10 minutes and have a very healthy snack. Then we need to be concerned about salt content. Nobody talks about salt content. If you have high blood pressure and if you have kidney problem, salt content is extremely important. And of course, cost. The bigger the label, the more fancier the package, the more hype a particular keyword is, it's going to cost you 2 to 3 times more. So let's keep all these things in mind and try to narrow it down to what is real and what is hype. The so-called friendly snacks. After having done extensive research, here I have come up with some observations which should seriously help you. Number one, they may be low in carbs, and some of them claim to be zero carbs, which is fine. I think that's an excellent point to start with. Some of them may have a high content of protein, which is also a good addition. But look at the cons. First of all, they may contain too much salt, especially the processed meat. They have to contain excess salt to preserve the meat. So think about the salt. They may not be low in calories. Like example, all these cheese products, chocolate products, they are not low in calories, gentlemen. They are just low in carbs because they're trying to hit a particular target market. That is, if you have diabetes, you shouldn't be eating carbs. Anything that is low carb is great. No, it is not great. It could be harming you more than what you think. Because as I said, I'm a holistic doctor. I look at a patient, when I see a patient in the office, I look at it as an entire human being who has hypertension, high cholesterol, diabetes, who has heart disease, who has stents, and has little kidney problem. When you have all these things, you can just tell them, I'm going to treat you for diabetes or sugar problem, and the rest we're not going to worry about it. Otherwise, they will end up with lung congestion in the emergency room after a few weeks. Okay, talked about calories, and along the same time, fat. Some of these are not cheap, especially the ones which have these special labels, high protein or keto-friendly or keto snacks like that. They are 2 to 3 times more expensive than the ordinary snacks, which you can get them or make at home, as a matter of fact. And as I said, all of these chocolate-based, the so-called snacks or cheese-based snacks are loaded with fat, many grams of saturated fat. So I want you to think. I want you to explore the facts. Look at the labels in the back and not the commercial hype or how attractive the package looks from a distance. Appearances can be deceptive. With this background in mind, let us look at some of the items that are promoted in the market. And I'll tell you, I'm just going to walk you through some of these things and I tell you what the problems are with these. No, these are good foods. They taste great and they do provide nutritional value. But maybe they provide more than what your body needs. For example, beef jerky is an excellent source of protein. It's mostly protein, but remember, these are a processed meat. So it has some preservatives. It also has salt. That's something you want to avoid. Anything that is processed here in this list, I'm not going to keep repeating that one. Think about fat content because they are high in fat content. For example, your pepperoni, more than 50-60% of the calories are coming from fat. So we talked about salt, preservatives, and fat. Tuna fish may be a good one, and chocolate. Again, you're talking about fat content. When you talk about low carb yogurt, you also look at the fat content and salt content. And when you're looking at this low carb smoothies, you need to look at what else is in these drinks besides just smoothies. Ice creams. Again, they go back to fat. I think the winner in this whole list is edamame. And I'm going to talk about edamame a little later towards the end of the presentation, and please stay tuned. And of course, pumpkin seeds are excellent source of protein, and they also have low fat content. And look at this salad. And I'm talking about, at the end of the presentation, I'll talk about how you can make your own snacks within 5-10 minutes in your house. And eggs are an excellent source of protein and very little carbohydrates, if any, probably nothing. And if you just take egg beaters, that's even better. Then you don't have the cholesterol and the fat that goes with that. But however, this processed meat like beef jerkies, ham, pepperoni, salami, you need to watch for the salt content. You need to watch for the fat content. And those are important factors when we look at before we select a snack. And here's another chart. It's the same thing. Carbs, fat, salt, you name it. Tuna may be an excellent source because it's no carbohydrates and it has very little fat, and whatever fat it has, it is polyunsaturated and omega-3 fatty acids, and that's a good source for a snack. The so-called low-calorie snacks, you can just totally forget about it if you are thinking about low-carb snacks. If you look at it here in this particular chart, everything is carbohydrate-based, like starch, potatoes, snacks, all these things, except this one, which is high protein. But the bottom line is, these are all, even though they say they are baked, you're getting 30, 40 grams of carbohydrates, and they just don't serve the purpose if you are dealing with sugar issues and weight. Okay, now let's look at something that is reasonable, something that is edible, reasonably priced. Doing all this research, I've been in cardiology for 40 years, so I'm constantly looking for ways to improve my own health, and that's what I'm sharing with you. I found this edamame dry roasted. I had ordered it from Amazon. Anyway, it's not cheap. It's $14 for 27 ounces, so which is pretty reasonable compared to some of those keto labeled ones, which are like $2, $3 per ounce cost. Anyway, let's look at in depth the labels of some of these items. Edamame, 130 calories, 4 grams of fat, 0.5 grams of saturated fat, 150 milligrams of cholesterol, sodium, which is not bad, and 11 grams of carbohydrates, 8 grams of fiber, so you're basically getting 3 grams of carbohydrates. So it's pretty reasonable. 13 grams of protein. The other thing, I've been testing this for a few months. This is a great snack if you're thinking about low carbohydrate, low fat, high protein, and reasonable cost. This is a lot cheaper than some of those keto labeled snacks. The other thing is, because it is so dry, you're not going to eat the whole bottle because you just get tired of it. So if you eat 1 ounce, after that you say, okay, I had it. That's good. You want something that will suppress your appetite because snacks are used to tame the appetite. Our crave for carbohydrates, crave for calories, crave for fat. That's what we are trying to do. Is kind of reprogram the internal mechanics in our brain. Yes, I'm a doctor and I'm still trying to learn how to reprogram the brain, but being an educated consumer helps. Okay, compare that. For the longest time, I thought peanut was excellent, has polyunsaturated fatty acids, maybe some degree of omega-3 fatty acids, not as much as we see that in walnut, macadamia nuts, and other nuts. But the problem here is, look at the label, ladies and gentlemen. Please pay careful attention. Peanuts, they taste great. Salted peanuts, 70 grams of sodium for 1 ounce, which is not bad, and carbohydrates hardly any, 7 grams of protein, and 14 grams of fat. Oh my gosh, what a day and night difference between peanuts and our friendly edamames. It has only 4 grams of fat compared to peanuts, which has 14 grams. And look at this. It has 160 calories, and most of the calories are coming from the fat. That's not good, even though it has polyunsaturated fatty acids. Okay, maybe it can be reasonable. Just maybe have half an ounce of peanuts at the most. But if you're sitting there watching a football game and you see half the bottle is gone, then you're in deep trouble. You'll be lucky if your spouse doesn't see that. Okay, let's move on to the next line of items. And here are the so-called keto snacks available in Walmart. What is the problem with these keto snacks? As I said, I am a heart doctor, but I look at the patient from a whole perspective. If they come to me, I say, do you have diabetes? What is your sugar level? What is your hemoglobin A1C level? If you have kidney, what is your creatinine? What is your kidney filtration rate? I look at everything because to me, everything that I give for heart can have an adverse effect on sugar, cholesterol, kidney function, and weight. So I have to look at it from a holistic point of view. So what is the problem with a lot of these keto snacks? One, they are expensive. The calories could be anywhere. It could be low, it could be medium or high. Of course, they have low carbs, which is their claimed fame, but a lot of them are high in fat content, and some of them have high degree of saturated fats. You need to look at the salt content. It varies from snack to snack. And for example, a cheese puff, it's like $26 for like a 22 ounce or something. It is extremely expensive, and all you're getting is cheese, which is fat. You don't want to replace one disease with another disease. You don't want to replace diabetes with a heart disease. That's not fun. I mean, that's not the purpose. And again, think about weight. And I keep talking about cost because I am for good quality food. Now, here is a side-by-side comparison of edamame and peanuts. $14 on Amazon. This is like half or little less than half of that. But what are you getting here? 4 grams of fat versus 14 grams of fat in peanuts, and 0.5 grams, 4 times more saturated fat. And look at this. You're getting carbohydrates, which are about the same thing, and you're getting twice the amount of protein in edamame compared to the peanuts. So which one would you choose if you have a choice? The problem with peanuts is they are addictive. I don't know whether you are aware of it or not. If you take a bottle of peanuts and you put it on the side of your couch and you start watching television or doing something, you're not even looking at the bottle, you're not even looking at your mouth, and then you turn around, oh my gosh, half the bottle is gone. That means you got 5 or 6 ounces, and multiplied 5 or 6 ounces, you're looking at 1,000 calories. That may be an overstatement, but that's the fact. So think wisely, ladies and gentlemen. That's what I'm trying to say. All these nuts are good if we are careful about the kind of nuts we choose. For example, walnuts are good in terms of omega-3 fatty acids, unsaturated fatty acids, and you need to look at the fat content. Same thing with macadamia nuts, whereas the other nuts, you need to look at the nutritional value. I have several videos on heart healthy, diabetes healthy diets. I cover all of these in different segments. You can watch those. Same thing with cashews. A lot of calories coming from fat. So keep that in mind. Okay, so what is the conclusion? The conclusion is very simple, ladies and gentlemen. I think you can have a couple of snacks that are ready-made and easily there to kill your appetite or crave. But there are creative ways where you can use, like fish or chicken breasts. Just grill them in the oven halfway through, then put a teaspoon of oil, some salt, some chili powder, some spices, your ethnic spices, some cilantro, and you have a chili chicken or chicken tikka or what I should say, like kung pao chicken, something like that. Whatever is your ethnic background, you can be creative and create this in like 5-10 minutes. That 5-10 minutes you're creating this special breakfast is already going to kill your appetite to a certain degree, because this is like snack attack. Snack attacks are dangerous because we just grab whatever is in the in the closet and we just start binging. This is a quick rundown of low carbohydrates, high protein, low fat, low cost snack alternatives. I have tried to make you an educated, informed consumer. Taking these concepts, you can create your own type of snacks, which you can prepare them in 5 to 10 minutes based upon your ethnic background. I hope this has been educational to you. I am Dr. Nik Nikam, a cardiologist from Houston, Texas, and please do subscribe to our YouTube channel, and I will see you in the next health